What kind of school is a school of public health? Really, it's science in action.
One could frame the world's greatest challenges almost inclusively as challenges to public health.
We're concerned about catastrophic risks. This is where the whole bioterrorism era has been born.
To make our spaces even better and healthier for people.
I work on the disease malaria.
Male-perpetrated intimate partner violence.
Long-term implications of dietary choices.
Molecular mechanisms underlying obesity and diabetes.
What you do can change the lives of millions of people.
The greatest increase in life expectancy in this country occurred in the first 50 years of the last century, before antibiotics, before heroic surgery, largely due to the impact of public health on preventing disease, on increasing sanitation and understanding how to prevent or limit epidemics.
Public health begins with a social goal to improve and protect the health of populations. Public health is about prevention, whereas most often clinical medicine is about treatment.
What is the deterrent effect of this kind of law going to be? We saw these sort of utility.
The interdisciplinary nature of work at the school is really important for the kind of work that I do. I can speak with my colleagues in the law school, I can speak with doctors in the medical school, I can speak with public policy experts in the Kennedy School, I can speak with economists over in the college.
The school began in 1922 with an emphasis on water quality, infectious disease, and sanitation. Over time, public health has evolved. The concern in the United States about infectious diseases has diminished, and the concern about chronic diseases and about environmental threats has grown, so that the mix of concerns in public health has changed. And so we seek to attract, train, and prepare people that will be the leaders of public health in the future.
Then we have to change health policy. How do we take our knowledge and translate that into not just training leaders, but have those leaders change policies that really affect the people on the ground everywhere in a very, very positive way?
We're in Botswana for a number of reasons. Certainly a very big reason is that rates of HIV infection in Botswana are the highest in the world. Secondly, because the government, the Ministry of Health, the entire group of people in charge of the country are really bought into the idea of having us work closely with them to do all we can.
I knew a lot about how to do things in the lab, how to conduct research. But what the School of Public Health gave me was really how to apply that research in the context of communities that were severely impacted by whatever disease.
There are many facets to the public health approach to malaria. Our work focuses on the basic mechanisms of the parasite biology and trying to use that information to discover what makes the parasite work, how it kills people, and then to use that knowledge to develop new drugs and vaccines. And so it's an adventure every day.
The countries that I have spent the most time in studying and working in are the countries that have been afflicted by pretty hot conflict or coming out of a bad, long war where the populations are trying to reconstitute themselves and rebuild societies. It's a record of human rights investigations over the last 15 or 20 years in areas of considerable turmoil.
My research interests here at the School of Public Health focus on intimate partner violence in immigrant and international communities. We're trying to understand what is it exactly that puts men at risk for becoming abusive towards their intimate partners, And what are these men's experiences and change men's behaviors?
Have you ever personally been discriminated against because of your race, ethnicity?
We are working in Boston, have been for over 2 decades, to define youth violence as a public health problem and to put forth prevention efforts.
First day I went to Tar Creek, which was some 7 or 8 years ago. I remember driving around and I turned to my host and I said, I thought the hill countries was somewhere up in Texas north of here. And she said, those aren't hills, those are chat piles. Those are piles of mining waste that have been lying there for almost 100 years. But we know nothing about how mining waste and the mixtures of metals that happen in these environments can actually interact with each other, greatly magnifying the effects of these toxicants.
We're working with corporate development companies that are building low-income housing, and they want to make it green. We're working with the university and developing sustainability principles. Included in those principles are health. Health of the occupants, health of the community. It has a lot of personal satisfaction.
So there's other ways of growing besides growing taller. All your parents are giving you advice about vegetables and about fruit.
We designed our school-based intervention, Planet Health, with the objective of really reducing obesity among adolescents, particularly among middle school students. And in fact, we found that the program was effective in reducing obesity among girls.
My area of interest is obesity, diabetes, and heart disease, and how these problems all occur at the same time. If somebody is working only inside the cell, I want them to see where does that cell sit in the organ. If we're only working in the organ, I want my students to see where the organ sits in the body. If we're thinking about the body, I want them to think about where the body sits in the neighborhood, where that neighborhood is in the city, in the country, in the continent, and in the world.
I don't know that what I'm working on will, cure obesity or diabetes, but I hope that it will be just one step in better understanding these diseases.
I felt I would impact more people doing public health work than just working in a clinic.
We found that in our large studies, higher intake of trans fat was related to higher risk of heart disease and type 2 diabetes. And that's led to many changes, including the fact that the Food and Drug Administration will now require trans fat content to be included on food labels. And overnight, that has a huge impact on what almost every American is eating.
There are multitudes of problems out there. There's poverty. Because of the increasing industrialization, there's so much more pollution. Safe water is not to be found easily. It's that bad. Like, we have landfills, and in landfills you have children who actually go and do rag picking out there. So you can imagine what they're exposed to. I'm interested in going back to do research which can then be translated into policy. That's why I really want to go back to India.
It's nice to work for a place where you can point to concrete things that are being done to improve the lot of people both in this country and in other countries. A lot of people who work here share in the mission, share in the spirit, and are happy to be a part of it, no matter how small our part might be.
As with all the students who come here, I will try to make the world a better place. I think that is the common theme of all the students with all their varied backgrounds once they come here.
You can see how the relative risk is increasing.
I'm helping other people to learn what's going on here at the Harvard School of Public Health.
Working at the School of Public Health is an opportunity to give something back. And there is nothing more gratifying for me than the belief that perhaps some of the ideas that we're able to come up with actually find their way into practice and make a difference in the lives of people.
One of the things we're trying to do is position ourselves to be a sort of rapid response team where we have groups of people across the disciplines who are poised to respond to the epidemiological, the economic, political, social, cultural consequences of emerging diseases.
Every student comes here with a passion to make a difference. And a lot of the students don't know quite how to translate that passion into something that's going to make a tangible difference in the real world. And we in the Division of Public Health Practice try to translate that passion in learning.
Everyone in this school has a sense that we have a mission and a destiny, not just to do their own research, but to make a big difference domestically and internationally.